Well, we know the holiday season starts next week, and while it might be an exciting time for many people, it's also one of the hardest times of the years for others. So joining us in studio this morning, Jennifer Campbell-Rabb, who is the Behavioral Health Educator Coordinator at Riverside Health. Jennifer, thank you so much because this is such an important topic. First of all, can you explain the holiday blues, what it actually is?
Sure. So the holiday blues typically start around November and they can go up until the new year. It's directly related to the holidays. There's a lot of stress that happens during this time of year. And so someone who's experiencing the holiday blues can be feeling kind of irritable. They can have some more heightened anxiety, and they can have some sadness and also some fatigue.
What are some of the triggers for it, particularly when you're talking about it being during the holidays, which a lot of people generally think are supposed to be happy times?
Yes. So we are told it's supposed to be the happiest time of the year, right? But it comes at a time when we also have other stressors in our life, so financial constraints and so forth. And so on top of all that, we have the layers of the holiday stressors, and that can be also, making sure that you have all the right food and your meal planning and your gift shopping, trying to stick to your budget, and you have a lot of expectations. Events that you might be expected to go to, things you're excited about going to, some things that you're just trying to squeeze in. And so it's a lot of pressures on top of the normal stressors of life. And
then you think about like grief as well. That's the time of the year where everyone is excited to be with a loved one, with a family member. And if you're experience loss at any point, then that also kind of plays a factor, I imagine.
Absolutely, you're right, Eugene. You can this can be a very triggering time for someone who is experiencing grief. And so they can be approaching the holidays with a completely different perspective than someone else. And so it's important to be mindful and sensitive to those, and to be able to try to connect with someone if you know they're grieving. And if you're grieving yourself, who can you reach out to for support? So think of the supports in your life, and perhaps you want to honor the person that you're grieving with a special ceremony or tradition.
Okay, so let's say that I am experiencing holiday blues, but I don't quite know that that is the case, but I know something's off. Or maybe I have a friend or a family member, I notice something a little bit different. What are some of the things I can look for and that I can kind of see something might be off and I need to maybe approach them?
So with the holiday blues, they're temporary and they're manageable. When it starts to become unmanageable and your symptoms are starting to get in the way of being able to carry out your day-to-day, that's when you might want to start thinking about reaching out for help. And I like the point that you make. Sometimes you notice it yourself. Sometimes somebody else will notice it about you. So if you notice it about yourself, there's different ways that you can reach out. You can start with your general support system. If you have somebody that you're close to that you can speak with, a family member, a friend, maybe it's somebody in your faith community, you can also reach out and talk to your primary care provider. That's a good start as well. There's mental health professionals. If you don't know where to start, the Substance Abuse and Mental Health Services Administration has a search engine, findtreatment.gov. There's all sorts of warm lines if you just need a listening ear. And then there's crisis lines if your symptoms start to increase. 988 is a good resource for that. And if you're noticing it with someone else and you want to figure out how do I kind of broach this topic, because you don't want to hurt anyone's feelings.
Right.
A good way to do that is just to name what you're seeing and bring it in terms of their care and their happiness. So, I noticed that you seem sad and that this has been going on for a while. So, can we talk about that and how can I support you? And that's a good way to open the conversation. And
I think another great thing about this, which I'm glad that you're here, is for people to know that if they are experiencing this, you are not by yourself. There are other people who experience this as well.
Absolutely.
There's a community, folks ready, as you just said, ready to help.
Absolutely. You're definitely not alone. This is something that is very common, and sometimes all you need to be among is people who have similar experiences. So support groups can be very validating for that as well.
All right. Well, Jennifer, thank you so much for being here today to break that down, and hopefully people were able to hear those tips and really hear it and get some stuff that can help them as we get closer to the holidays.
Yeah, absolutely. Thank you.